This figure shows the serological pattern of acute HBV infection. After infection, first, hepatitis B surface antigen appears and increases within 2 to 10 weeks. Next, IgM anti-HBC and total anti-HBC increases after 2 weeks. IgM anti-HBC is a specific marker for acute HBV infection and it decreases and disappears after 32 weeks. Total anti-HBC, mainly IgG anti-HBC, continues to be positive for life. Thus, total anti-HBC is the marker for post-infection. Hepatitis B surface antigen decreases and disappears within 6 months with acute infection. After that, the neutralizing antibody, anti-HBs, appears. In this phase, the person is considered as cured. We will now look at interpreting the panel of HBV serological markers. This is important in clinical practice when you receive results back from the lab. Hepatitis B surface antigen negative and anti-HBs negative means never exposed. Total anti-HBC positive and anti-HBs positive means past natural infection, cleared and immunity achieved. For the figure, the red dash box shows past natural infection, cleared and immunity achieved, where total anti-HBC and anti-HBs tests are both positive. This figure illustrates waning of the anti-HBs levels which have dropped and disappeared over time and where total anti-HBC remains positive. Total anti-HBC only positive also means past natural infection cleared and anti-HBs levels have waned over time. So, for the interpretation of the test, we can say past natural infection cleared and anti-HBs levels have waned over time. In this figure, we illustrate the above slide on recent infection, recovered immunity achieved. Noted the red dash box, anti-HBs levels have dropped and disappeared. Anti-HBs only positive means immunity due to vaccination. HBs negative, total anti-HBC positive, IgM anti-HBC positive, and anti-HBs positive means recent infection, recovered immunity achieved. In this figure, the red dash box illustrates that acute infection is ongoing, and where HBs is positive, total anti-HBC is positive, IgM anti-HBC is positive, and anti-HBC is negative. Hepatitis B surface antigen positive, total anti-HBC positive, IgM anti-HBC negative, and anti-HBs negative means chronic infection is ongoing. From the point of screening for HBV infection, the lower two boxes highlighted is important. If hepatitis B surface antigen is positive after screening, IgM anti-HBC is useful to differentiate between acute and chronic infection. However, IgM anti-HBC may not be affordable or available in resource-limiting settings. In such cases, clinical symptoms related to acute hepatitis or clinical infection are useful.